In Melbourne have developed a new clot-busting drug that can be administered to patients before they reach hospital.
Yeah, so we brought in our medical expert, Dr. Zach Turner. Zach, exactly how does this new drug work?
Well, one, it's really exciting that we're doing these things in Australia. I mean, it's great that Monash is coming forward with these great medical breakthroughs. And as opposed to most of us in terms of getting a stroke or having a heart attack, we get a clot, it stops the blood flowing through, and we either cark it, which is terrible because the blood won't get through, or you get a hemorrhage. Now, this is a really interesting treatment because prior to this, a lot of the treatments would target all of your blood cells, all the way throughout your whole body. But this one is quite targeted to that specific clot. So they can put it in and it will target that clot specifically. There is a little bit of drama with this, though. Like I said, you can either have a clot, which causes you to have a stroke or a heart attack, or a hemorrhage. Right. And that's where you get an open vessel. And so if you break down the body's ability to clot, then that can be...
That's right.
You could bleed out. So what we're looking at doing now is getting first response teams, so in the ambulances, to be able to actually test to see whether this is a clot or a hemorrhage, and then basically administer this drug to people. So it could actually save hours eventually. I mean, this is a little bit down the track.
But in the case of stroke and heart attack, it is an extraordinary breakthrough, isn't it?
It could be great, yeah. This has potential to be huge, and it also will help to push forward a whole lot more research into more technology for ambulance officers.
It's still in its trial stages. When can we expect it to be available here?
Who knows? There's more and more training and development happening. We're using it on animal models at the moment, and it's had some great results. They're now looking at funding to start bringing out, because it's essentially almost like a vaccine, because it targets those clots. So there's a lot of research into that, and often these things take and cost billions of dollars. But certainly this is really exciting to start with.
I want to ask you why you're here about something else, about the vitamin D. Apparently taking supplements on a daily basis, this is just as effective as a flu vaccine. Is that for real?
Yeah, well, I mean, this is surprising to a lot of people. So taking a flu vaccine doesn't just automatically get rid of the chance of flu. You have a percentage less chance. So, I mean, it's about 16% chance of getting the flu if you have that vaccine. So vitamin D, because it helps with your immune response, it helps to help grow more muscles and bones. This has been shown to be just as effective as the flu shot.
Sorry, I thought you said butt muscles then.
Potentially with the double dipping.
Yeah.
But no, this is a great way, and a lot of Australians aren't getting enough sun. If you can believe it or not, we are so good at slip, slop, slapping
that we're not getting the vitamin D.
Exactly, and a lot of people.
How much time should we spend in the sun to get the right amount of vitamin D?
10 or 15 minutes a day.
And that's
just a quick walk.
That's exactly right.
Okay.
Quick walk. Go right there, spin around in a circle with your shirt off, do something dramatic, and you can have a lot of fun and get your vitamin D levels up. So.
And maybe avoid the flu.
Avoid the flu, exactly right. And great studies to show that this is really helping, so especially in the Northern Hemisphere.
All right, Dr. Zach, good to see you. Thanks for coming in, buddy.
Thank you, Dr. Zach.